We don't always feel pain when we damage our tissues. There's, a lot of examples of people experiencing tissue damage but not feeling pain, and there's also examples of people feeling pain but not having damaged tissues. We don't always feel pain when we damage our tissues. There's, a lot of examples of people experiencing tissue damage but not feeling pain, and there's also examples of people feeling pain but not having damaged tissues. But for most of us, most of the time, with acute pain, an incident happens that we might move or twist, or something unusual happens and we get some damage to our tissues. It's normal to have pain as part of our protective response. But sometimes our pain system responds a little bit oddly, and even though our tissues have healed, our pain system, which is part of our sensory system, continues to keep pushing messages of pain. In our body, we're constantly getting information from our tissues. We have little nerve endings that sit in all of our tissues, and they're monitoring what's happening around our body all the time. When there is tissue damage, or sometimes just when your body thinks there's tissue damage, these receptors turn on and they pass information along your peripheral nerves into the spinal cord, where that information gets a little bit sorted, and then that information is transferred up into your brain so it knows what's going on, and your body then decides to have a response, or decides on a response. Our brain's response is not just having pain, it's also changing the way that we move. So it might be something like limping, or it might be sit down and take the load off. If it's a cut, it might be having a look at that and then getting that bandaged. It gets involved, so it helps deciding what to do. When there's tissue damage, the information that passes along our peripheral nerves is called nociception, and we can measure that running along your nerves. And then this information moves from your spinal cord up into your brain, and then your brain decides whether or not a feeling of pain is useful and helpful to help protect your body from further harm.